वेलकम टू RRB NEXUS। इन आवर रैंडम क्वेश्चन एंड आंसर सेशन हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्सेट, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। जॉइन अस रेगुलरली टू मेक श्योर योर सिलेक्शन।
Which of the following is not an adverse effect of morphine? A. Euphoria. B. Respiratory stimulation. C. Nausea. D. Histamine release.
And the answer is option B, respiratory stimulation. Here's a summarized explanation of the adverse effects of morphine. Morphine is a powerful pain-relieving medication. Adverse effects of morphine include 1. Respiratory depression, slowed or suppressed breathing. 2. Euphoria, feeling of extreme happiness or well-being. 3. Nausea, feeling of wanting to vomit. 4. Histamine release, can cause itching, hives, or swelling. Respiratory stimulation is not an adverse effect of morphine. Other adverse effects of morphine are related to its depressant effects on the respiratory system, potential for addiction, and allergic reactions caused by histamine release. If you have any further questions, feel free to ask in comment section.
Age-related hearing loss is known as A. Otosclerosis, B. Otitis media, C. Presbycusis, D. Presbyopia.
The correct answer is option C, presbycusis. Presbycusis is the term used to describe age-related hearing loss. Here are the key points explaining why option C is the correct answer. 1. Presbycusis is a common condition. It is the most common form of hearing loss and is associated with the natural aging process. 2. Gradual loss of hearing. Presbycusis develops slowly over time, typically starting around middle age or older. 3. Age-related factors. The exact causes of presbycusis are not fully understood, but it is believed to be the result of cumulative damage to the sensory cells in the inner ear, along with changes in the structure of the ear due to aging. 4. High-frequency hearing loss. Presbycusis typically affects the higher frequencies of sound first, making it difficult to hear and understand speech clearly, especially in noisy environments. 5. Name origin. The term presbycusis originates from the Greek words presby meaning old or aged, and cusis meaning hearing, reflecting the age-related nature of the condition. Based on these points, presbycusis is the most appropriate term to describe age-related hearing loss.
Which of the following is not true about universal precautions in the healthcare system? A. Reducing the level of contact with blood and body fluids. B. Maintaining the confidentiality of known carriers. C. Aiming to reduce cross-infection. D. Assuming that all blood and body fluids are safe.
And the answer is option D. Here's a summarized explanation of each option. A. Reducing the level of contact with blood and body fluids, true. Universal precautions aim to minimize contact with blood and body fluids. B. Maintaining the confidentiality of known carriers, true. Patient confidentiality, including known carriers of infectious diseases, must be maintained. C. Aiming to reduce cross-infection, true. Universal precautions aim to minimize the risk of disease transmission between individuals. D. Assuming that all blood and body fluids are safe, not true. Universal precautions do not assume safety, they consider all blood and body fluids potentially infectious. To summarize, option D is the correct answer as it states something that is not true about universal precautions, which is assuming that all blood and body fluids are safe.
Which of the following options represents the main arterial stem of the upper limb? A. The femoral artery. B. The basilar artery. C. The carotid artery. D. The axillary artery.
And the answer is option D, the axillary artery. Here's a summary with key points. The femoral artery is not the main arterial stem of the upper limb. It is located in the lower limb. The basilar artery is not related to the upper limb. It is found in the brainstem and supplies blood to the brain. The carotid artery supplies blood to the head and neck region, not the upper limb. It is not the main arterial stem of the upper limb. The axillary artery is the correct answer. It is a major blood vessel in the upper limb, originating from the subclavian artery. It supplies blood to the shoulder, upper arm, and some parts of the chest wall. Therefore, the axillary artery is considered the main arterial stem of the upper limb as it provides blood to the majority of the upper limb structures.
And for additional query search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.